Hello, this is Dr. Richard Cunningham from Vail Orthopedics. I see a large number of young, active, and very athletic patients here in the Colorado Rockies. I often see young patients, usually in their teens, with anterior knee pain. In my experience, this pain is caused by muscle imbalances. More often, the quadricep muscles and the hip flexors in front of the leg are stronger than the muscles in the back of the leg, namely the hamstrings and the gluteal muscles. These imbalances set up tightness in certain tendons, which in turn can lead to maltracking of the patella and some anterior knee pain or pain around the kneecap. With the help of Donny Leblanc, who's been a personal trainer in the Vail Valley for over 20 years and who has helped me personally a great deal, I wanted to show young athletes some exercises that they can do to prevent these imbalances and the resultant knee pain that develops.
Right, so we're going to start off with a little glute manipulation, and Hannah here is going to start with a 12-inch softball. She's going to put that right under her glute. She's going to roll back and forth for a couple minutes, and then she's going to go ahead and tuck her shoulder down to the mat. Go ahead and tuck your elbow, bring it under, and she's going to bring it around to the front and get into that psoas here. And one of the things we want to do is work it back and forth from the front to the back and get those muscles to loosen up so that we can begin to make them strong. Oftentimes they're shut down, and we want to be able to loosen them up before we can actually start to strengthen them. So oftentimes when the front of the hip is closed up, which many of you know is the hip flexor, the opposing muscle to it, which is the back right here, is kind of shut down. So not only when something is tight do we want to stretch it, but we want to strengthen the opposing muscle to the tight muscle. So many times when the front and the hip flexor is tight, we go back here to the glutes, which is the hip extensor, and Hannah, go ahead with a straight knee, lift your leg. And this muscle right here on her, you can see how it fired. But many times when your knee is sore, this muscle right here will stay dead and won't fire very strong or will fire late. So we want to get this manipulation that's going to, with the ball rolling, help manipulate it, and then go into extension again, Hannah, and she's going to fire it and back down. And again fire it, and that's going to help get that glute firing again. So the combination of rolling the side of your leg, rolling the back here, is going to help take the stress off the knee. So when we talk about the front being really closed up right here through the psoas like that, and it stays like that, and it rolls your hips forward like that, puts a lot of stress on the knee. So one of the things we really want to be working on with that hip strength is that you're centered on your hips. So one of the things we really want to work on is a little hip abduction, and that's really helps in your lateral move. So Hannah, go ahead and do a leg abduction. One of the things she really wants to focus on is keeping her hip open right here and not closing it and involving the hip flexor. We really want to put the focus back here. As you progress and begin to get stronger, we want to add load. So Hannah right now has a 9-pound bar and has gone from nothing, and remember, everything is a progression. So now we're going to work on a little hip adduction, and Hannah's up here, she's got her upper foot elevated, she's going to bring her lower leg up, and now we're going to work those adductors. Remember, the whole thing we're creating here is balance, and the more balance that we can have through our hips, the less strain we're going to have on our knees. And this again, as she begins to get stronger, she's going to add load, and again really focus on keeping that hip opened up and working on those adductors. So last but not least, we're working on a little hip extension. Again, it's the opposite of the hip flexor, and again we're trying to create that balance through the hips.
I'm Dr. Richard Cunningham, and thank you for watching this short educational video.